Effects of lettuce seed oil in patients with insomnia disorder, a randomized controlled trial. I am Dr. Mostafa Yakoot. Insomnia is a subjective complaint that sleep is difficult to initiate or maintain, or it is non-refreshing. Insomnia disorder is defined as insomnia for at least 3 nights a week for at least 3 months. It is the second most common mental disorder and it affects about 20 to 40% of older adults. Insomnia is mostly treated with benzodiazepine and non-benzodiazepine hypnotic drugs. However, residual daytime effects, development of dependence, and withdrawal symptoms associated with most hypnotic drugs are of considerable concern. Lactuca sativa or garden lettuce is one of about 50 species of the genus Lactuca from the plant family Asteraceae. It is cultivated in Egypt and in some Asian and European countries and is used mostly as a salad herb. Lactuca sativa has been in use since ancient Egyptians as a folk remedy for many disorders including insomnia or sleeping disturbance. And this has been documented in many pharaonic literatures including the famous Ebers Papyrus in the year dating back to the year 1550 before Christ. Lactuca sativa seeds as a decoction or pressed oil have been used to induce sleep and calm in cases of insomnia and anxiety. The seed oil has also been used externally on the head for the treatment of headache, hair falling, and induce sleep. Powdered seeds were used orally for cough, colds, and asthma, while a milky latex extracted from Lactuca sativa, called lactucarium or lettuce opium, was used for its sedating effect. It contains lactocene, lactocone, lactobacrin, and a trace of triterpenes as well as iron and vitamins B1, B2, and vitamin C. Quantitative analysis. The cold pressed seed oil of Lactuca sativa was subjected to qualitative and quantitative studies with different chromatographic techniques. Gas liquid chromatography revealed that oil is built up of oleic acid, stearic acid, palmitic acid, along with other 7 fatty acids, while the thin layer chromatographic study identified a good content of beta-cetosterol and beta-amarin. Preclinical studies. The oral LD50 in mice is about 19.7 milliliter per kilogram. Lactuca sativa seed oil exhibited a pronounced sedative effect in the locomotor activity test in mice, and it potentiated the hypnotic effect of barbiturates in a study done in Mansoura University and published in Phytotherapy Journal by Saeed et al. Phytotherapy 1996. Lactuca sativa demonstrated a significant analgesic effect in another study on animal model of pain, acetic acid-induced pain test. Also, it showed a significant anticonvulsant activity against pentyl-N-tetrazole-induced convulsions in mice, and this was published in the Journal of Ethnopharmacology in the year 2004. Objectives. We planned this study to evaluate the sedative and hypnotic effects of Lactuca sativa seed oil in human subjects suffering from insomnia with or without anxiety. Material and methods. 60 patients suffering from insomnia disorder were randomized by computer-based block randomization technique to receive either a soft gelatin capsule named Sedan containing Lactuca sativa seed oil 1000 mg in 30 patients, or a similar placebo capsule in another 30 patients every night for 1 week. All patients were asked to complete 2 verbal questionnaires, the sleep rating scale questionnaire and the modified state rate and anxiety inventory scale questionnaire before the start of treatment and at the end of 1 week. Safety and tolerability analysis were based on intention to treat basis, while efficacy was based on the per protocol analysis of the scale scores. This is the sleeping scale questionnaire composed of 10 questions. Each one is scaled from 0 to 2, 0 nil, 1 sometimes, and 2 often. The higher the score is, the worse is the patient problem. And this is a modified state rate and anxiety inventory scale composed of 20 questions. Each one is scaled from 1 to 4. The higher the score is, the worse is the patient problem. Results. 25 patients in each treatment group completed the study and included an efficacy analysis. Both groups were well matched for age and for sex distribution, as we see in this graph. Construct validity and reliability for the 20 and the 10 items of the state rate and anxiety inventory scale and the sleeping scale were confirmed by factor analysis and Cronbach alpha tests. The effect on the sleeping scale. This graph shows that the mean sleeping scale score before in green and after treatment in each treatment group. Lactuca sativa treated group on the left showed greater improvement in the mean sleep score by independent sample t-test with high statistical significance and p-value of 0.009. Effect on the state rate and anxiety inventory scale. This graph shows the mean state rate and anxiety inventory score before in green and after in red each treatment group. There was a greater improvement in mean state rate and anxiety inventory score by Lactuca sativa oil with significant p-value. The overall efficacy and safety results. This graph shows the differences in mean scores of both scales by treatment. This is by the Lactuca sativa seed oil treatment, and this is in red by the placebo. We conducted a multivariate analysis of covariance model for the effect of treatment on both state rate and anxiety inventory scale and the sleeping scale scores, adjusted for baseline scores and center as covariates. This showed a superiority of Lactuca sativa with high statistical significance. No serious or grade 2 or above adverse events were reported, but only few mild gastrointestinal symptoms in both groups, not causing interruption of treatment, and were comparable in both groups. In conclusion, Lactuca sativa seed oil might be safe, helpful sleeping aid and could be considered as a hazard-free, natural, over-the-counter treatment option, especially in geriatric patients suffering mild to moderate forms of anxiety and sleeping difficulty. Larger multi-center studies are recommended to confirm these promising results. Thank you very much.